Describe the difference in role and training between paramedics and emergency doctors. In the United Kingdom, there are 26,000 registered paramedics and 15,129 doctors with specialities in anaesthetics, intensive care medicine, and emergency medicine. After studying science-related A-levels at school, a 5-year medical degree must be undertaken as recognised by the General Medical Council. This is followed by a 2-year foundation programme as a consolidation of medical school knowledge, and then another 6-year programme in emergency medicine, overseen by the Royal College of Emergency Medicine. Following exams taken in the last period of time, doctors are eligible for posts as A&E consultants. The whole process takes around 13 years, which is considerably longer than that of 2 to 4 years of a paramedic's training. The salary of an A&E consultant is almost 4 times that of a paramedic. There are 3 routes to becoming a paramedic. The first being a full-time degree, which gives a degree in paramedic science. A-levels expected are BBB, including a science, as well as relevant healthcare or first aid experience. A full manual driving license is expected, and the degree takes 2 to 4. The second is being a student paramedic, which emergency doctors can be expected to work in accident and emergency, a 24-hour service offered by the NHS where patients dropped off by ambulances or walk in themselves. There can be resuscitation wards in the accident and emergency unit that provide life-restoring treatment. Doctors trained in emergency medicine can also work in intensive care units that look after patients in the most critical condition, using their quick thinking and skills to save lives. The paramedic is usually the first healthcare professional to meet the patient, therefore providing primary care. They oversee many jobs, including driving ambulances, responding to 999 calls, and assessing patients, with the capability to provide emergency treatment or medication when required. This includes continuous treatment when in transit. Also, an important role held by paramedics is to provide hospital staff with patient information and current treatment. This needs to be done effectively and efficiently to give the patient the best and most responsive treatment. In an emergency, paramedics will use equipment such as defibrillators. The role of a paramedic when arriving on the scene of emergency is to assess. They assess the scene, they assess the patient's injuries, and try to find out about any pre-existing medical conditions. Obtaining a history is secondary to treatment. Life-threatening problems should be assessed and treated prior to taking this history. Any patient experiencing chest pain should be placed under cardiac monitor. Paramedics also have a role in handover. There are standardized handover communication frameworks which have led to improvements in accuracy and speed of information transfer, but impact their time on critical scenarios. Patient outcomes might be improved by paramedics staying for a little. With well-publicised pressures on accident and emergency services in the UK, some aspects of hospital care are emerging out into pre-hospital setting, with many of these jobs being carried out by paramedics. An amendment to the Human Medicines Regulations from 2012 was made in 2018, allowing for advanced paramedics to gain the right to prescribe medications. People with asthma would be able to receive steroids to improve their breathing more quickly, and painkillers could be administered to those suffering with chronic pain. Antibiotics could be given to elderly people with infections, which would mean that patients would be treated quicker. Many people would be able to start treatment without delay, which would be critical in some cases, such as with sepsis. In the West Midlands Ambulance Service, Medical Emergency Response Incident Teams, also known as MERITs, have crews made up of both doctors and paramedics. This has aided the treatment of many critically ill patients, with the timing and expertise of these crews at the forefront of this. The future of emergency medical care appears to be less with hospital involvement, with this being headed up by paramedics. The roles of paramedics and the emergency doctor are very different but complement each other. Without the quick response and action of a paramedic, patients would be in a much worse position when they present to A&E doctor in hospital, and without the knowledge and skills of A&E doctor following handover, it could be easily a matter of life or death for patients. Advanced Life Support Algorithm is a set of life-saving protocols and skills which provides a standardized approach to management of patients in cardiac arrest. Heart rhythms associated with cardiac arrest can be divided into 2 groups: shockable rhythms, ventricular fibrillation, and non-shockable rhythms, asystole and pulseless electrical activity. The main difference in the treatment is that patients with ventricular fibrillation require attempted defibrillation. Thank you for listening to this presentation by Alex.